to getting ready for work. Well, welcome back this midday. Today we welcome a new expert to our team of Healthline 3 physicians. Today we are talking with OB-GYN specialist Dr. Erin Gullatt. And if you're watching online, remember that you can submit all of your questions on the right-hand side of your screen. You can give us a call as well to talk with Dr. Gullatt completely free of charge. So Doctor, welcome aboard. Welcome to our team. We're so excited to have you here.
I'm happy to be here.
Well, you are an OB-GYN specialist, and I know there's a lot of women out there who probably have a lot of questions. So first of all, I want to introduce you to the public. You are new to our team here, but you're certainly not new to Shreveport.
Right. Yeah, I grew up in Shreveport, Bossier. I've been, up and down the state of Louisiana throughout my training, and I'm happy to be home to care for the women in our community.
Excellent. And I know that women, being in your family, being one of two other sisters and having a mother, you just have that connection with women already.
Yeah, I feel like that has maybe a lot to do with it. I'm the middle of 3 girls, and so I was always kind of the mediator, and as far as dealing with, relationships with women, and then throughout medical school, I realized that I really liked the continuity of care with patients, but I also enjoyed surgery and deliveries and things like that, and a field in OBGYN offered me all of those things.
So now you have the chance to come home and do exactly what it is that you love to do. So let's talk a little bit about your specialty. First of all, tell me a little bit about a woman receiving care from an OBGYN. When and at what point do they realize that it's time for me to start seeing one outside of my family physician?
Right. It is recommended, for all women to see an OBGYN. They can start as early as adolescence or puberty if they're having any issues. Even I see some girls even younger than that, from pediatricians who, need a little extra support in the specifics of GYN. And then really early on, it's just kind of, I spend those visits educating those young girls on what to expect, how do I handle different things as far as puberty goes, and then it just gives us an opportunity to develop that relationship so that when things arise later on, I can, navigate through that with them, as well as it gives me an opportunity to help them with their health maintenance and make sure that they're up to date on everything that they need.
And how often should someone see their GYN?
Every year. Even if they're not having any issues, it's important to have an annual visit. There's lots of things that we discuss at that visit, exams, as well as just health maintenance that we keep up with.
All right. And should someone actually see the doctor if they don't necessarily have an issue, but they should still see you quite regularly?
Yes, even if they have no issues, if they're healthy, we call them well woman exams or annual visits. And those are very important because a lot of times we catch things before they become a problem. And it's a lot easier to fix things early on sometimes rather than wait until they actually notice that there's an issue.
What are some of the general questions that you get that some women might be embarrassed to ask in public or, openly with a physician, but something that's more common?
Maybe asking questions about, as far as their menstrual cycle goes, or what's normal and what's not normal, or a lot of women as they get older, get embarrassed to talk about things like leakage of urine, like is that normal? And actually, if I ask a lot of patients, they will tell me that they have some of those issues, but they wouldn't have brought that up if I had not asked them.
And typically at what age do you start to see that?
Sometimes it can happen early on after childbirth, and really young women, and a lot of times after menopause, it's very common. Most of those women can, most of women that age can have leakage of urine unexpectedly, and there's lots of things that we can do to help that.
Wow, very interesting. There's just so many little nuances that I'm sure a lot of people don't even think to ask you. What options are available when it comes to childbirth or using hormones?
So as far as childbirth goes, there's a spectrum of things, that we could talk about. I basically, as far as prenatal care goes, I'm talking to my patient throughout their entire pregnancy on things they can do to stay well, things they can do to prepare for their baby, things that they can do to be ready for delivery. And we talk about, what do they expect as far as delivery goes. A lot of patients do have a birth plan and some don't. Some don't know what a birth plan is. And we talk through all of those things. Some patients choose to have natural childbirth, and other patients choose to have medication. And a lot of it's just kind of me talking to them, what's best for you and what do you feel comfortable with. And what's great about our field is we can kind of cater, to the patient, and as long as it's safe, then that's our job, is to help them have the delivery that they hope for.
Excellent. I've never had children. When I think of a birthing plan, I'm just not so sure what that means. Like I think of medical plans that you might have, or banking plans with your money, but how can you actually plan when it comes to having a baby?
I always kind of joke that we can have a plan and we can be as prepared as we want, but a lot of times the babies or the delivery itself have their own.
It happens on its own, yeah.
Exactly. They have their own plan, and we just have to go with the flow. So I always, counsel my patients that they need to be prepared for changes, but it is good to have a plan in mind. Do you plan to get an epidural? Would you rather have natural, labor without an epidural? Would you like to be induced? Would you rather wait for labor? When is it safe to, things like that? And then after delivery, do you plan to breastfeed? Would you, rather use formula? There's lots of different things that it's good to kind of, even if your decision changes at the end, it's good to have that plan in mind, just to prepare.
All right, so we talked a little bit about childbirth. What about hormones? Oh, wait a minute. We've got someone on the call already for you.
Okay.
Martha is on the line. What question do you have for Dr. Gullatt?
I want to know how long, if you had a hysterectomy, how should you go about getting those? That's me.
Martha?
Yes.
Did
when
you
have
have
a hysterectomy? Yes. Yes.
I don't know, maybe she's asking, after you have a hysterectomy, it is still a good idea to see your OBGYN physician. There are other things that can arise other than problems with your uterus, which is what we removed during a hysterectomy. So we still can fix lots of things that could go wrong or prevent problems from coming even after a hysterectomy.
Martha, was that the question that you had for the doctor?
Yes.
So she's basically letting you know that it's still okay to come in and see an OBGYN, yes. Martha. I think, did we answer your question correctly?
Yes.
Excellent. So, and where, if Martha wanted to go and see you, how can she get in touch with you?
She could call our clinic at Willis-Knighton Pierremont OB-GYN Specialists. I believe the number is 212-3890.
All right. Well, Martha, does that answer all of your questions?
Yes, thank you very much.
You're welcome.
Right. You have a blessed afternoon. That is an interesting question. When I think of a woman getting a hysterectomy, it's almost like she's losing that uterus and all of those things that kind of make her a woman in that sense. But still, what are some of the other things or complications that a woman can run into, even
after hysterectomy? We talk about, depending on, some patients still need pap smears after hysterectomy, some do not. Whether or not their ovaries are still there, they still are at risk. If their ovaries are there, there's still a risk for ovarian problems. And then we also do breast exams and make sure that they're up to date on their mammograms and any other general labs or general health things as well.
Excellent. And oftentimes I think about STDs. We don't talk about STDs anymore. Why is it important to really start seeing an OBGYN young and early as possible? I know when we think of like the human papillomavirus and so many things that women can contract, why is it important to meet with someone like you?
There are a lot of sexually transmitted infections that may not have a symptom and until later in the game, and it could affect their long-term health or their fertility or things like that down the road that they may not care about now as an adolescent or at a young age, but later in life that would become important. So, and as far as the human papillomavirus, it's just so common that, so many people have that virus, and we can talk about the HPV vaccine, and things like that that could prevent you from ever getting the HPV virus, which in turn could prevent you from having any abnormal pap smears or cervical cancer.
And this is something that you can really only get, or it's only effective if you give it to the person prior to them actually having sexual intercourse. Is that correct? So that's why a young age is important.
For the most part, yeah, it's important to get it as early as possible, which even now we're recommending it, into later ages, but the earlier the better.
All right. Anything else that you could think of that I'm not thinking of? Even though I know I'm a woman.
Well, I see there was something else you asked me about with childbirth, and then
hormones.
Hormones. That's right. I knew there was something else that we were going to get to. So hormones. There's lots of different things that you can read and find out there about hormone replacement therapy. There's lots of studies done about it. It is safe. It just depends on the patient, and you just have to make sure that you are a good candidate for being on hormones and that it's safe for you to be on hormones. So there are some patients that it's not a good idea, and that's our job as an OBGYN physician to counsel them one way or the other. So a lot of times we are using hormones to treat menopausal symptoms.
Well, it sounds like we already have another caller on the line for you. I believe Tamita is on the phone. Good afternoon. Tamita, are you still there? Oh.
Yes. Good afternoon. I wanted to ask a question for the doctor, because I had an episode that it was really strange. I had a pap smear after hysterectomy, and some of the cells came back precancerous, and they gave me some hormones. And after they did the second pap smear, it came back normal. So why does that happen?
That's kind of a difficult question depending on exactly what the pap smear results showed. There's a variation of pap smear results, and it could have been that maybe it didn't actually show precancerous cells, but more showed inflammation or atrophy or something like that. That can happen with menopause. And a lot of times, if that's the case and you treat it with a hormone cream, then those cells can be repaired. But if it were, like I said, that's kind of a difficult question without me actually seeing the pathology report from the pap smear.
So is this something that maybe she should come in and see you specifically?
If you have more questions about that, it would be a good idea to see, myself or your OBGYN physician. It's helpful whenever we have new patients come see us, or if they're transferring, that to have their records, just so that we can actually see the report as opposed to your interpretation of it.
Does that answer your question, Tamita?
Yes, absolutely.
All right. Thank you so much for calling us this afternoon. Do you have any other questions?
No, I just wanted to know, because that was never explained to me.
Okay. Well, thank you once again for asking. And I want to ask you, is this something that you see commonly in relation to what she just asked?
It is not uncommon to see some atypical cells, we call it, or inflammation in women after menopause if a pap smear is done, because they are lacking in estrogen, which is what keeps those cells healthy in those tissues.
Would you consider those cells precancerous, or is it just a change in the cell that you're starting to see something is different? And
I wouldn't necessarily consider it precancer.
Okay.
A lot of times we really don't know that diagnosis until a biopsy is done. So in her case, I'm not sure if maybe they had gone down that road, and it's very there's lots of different things that could be going on.
Okay, and so you don't want to make any type of assessment on camera, not knowing for sure
exactly
what that patient is doing. It's almost like going to Wikipedia.
Right, right. You have to be careful who your resources are, and it's helpful to have all the information before a diagnosis is made or a decision is made.
Absolutely. We don't want to scare anybody.
Yeah,
so.
I find that sometimes patients can, misinterpret. They hear the word cancer and they think,
right.
They think worst case scenario. But a lot of times what we're finding on pap smears is really not a cancer or even a precancer. The way I describe it sometimes is cells that are abnormal that if left alone could one day progress to a precancer or even a cancer. So it's kind of a confusing diagnosis to make, because a lot of times in communication, patients can hear, cancer
Information, yes,
exactly,
and they just those just trigger words.
Yeah, it's why education is very important.
And I believe we already have another caller on the
Okay.
line. Marty is calling us today to ask Dr. Gullatt a question. Good morning.
Good morning. I wanted to ask at what age does a woman stop having to have the GN exams, pap smears, or mammograms?
That, as well as patient dependent, it would be a conversation that you have with your OBGYN physician. Typically around maybe 70, 75, I start having conversations with my patients about whether or not there's any utility in them continuing to come and have exams and mammograms and things like that. So, but we're happy to see patients for as long as they want to keep coming.
Aw.
Okay.
Does that answer all your
Thank
questions?
Well, that does answer my question.
I'm sorry, there's not just a cutoff. It really is, every person's different. So we make that decision based on your history and your health.
Yes. Thank you.
You're welcome.
All right. Got a lot of ladies calling in this afternoon. It's so important, I think. Women's health is something that we just don't even realize that we need. We continue to go to our family physician, but it's always best, I think, to see a specialist
Yeah,
about
and a lot
these
of times
things.
we just don't talk about it, and I think that it's kind of, something that people are either uncomfortable to talk about, or it's just not, it's kind of, but once you start discussing it, then make it more normal, but I find lots of patients who, once I start asking questions, they're like, oh, I thought that was normal. And I'm like, no, we can fix that, so.
Is there something that a woman should look at maybe in checking herself or giving herself an exam and say, you know what, maybe I need to see my physician about this?
For women, that are...
Oh, my OBGYN, excuse
Yeah, right.
me.
For women that are, premenopausal, they're still having menstrual cycles. One of the most important markers of their health is, are their cycles coming regularly? And if they're, having cycles approximately once a month, then, and they're pretty regular, then that's reassuring, that everything is normal. As far as breast...
Oh, go ahead.
I'm sorry, go ahead.
What about a heavier blood flow?
Right. Some patients have, there's a wide range of normal when it comes to that. There are some patients that can have such a heavy cycle that they're becoming anemic, and even to the point of some requiring blood transfusions, and that is not normal. So, that's our job as OBGYN physicians, is to ask you questions about your actual cycle and what's happening, and kind of figure out if that is normal or not, or if it requires some type of workup.
Is that a sign of premenopause?
No, not necessarily.
No? Okay.
Yeah, some adolescents who come and see me are having heavy menstrual cycles, and a lot of times we'll use things like oral contraceptives or things like that to treat that.
All right, and it looks like we got another caller already. Juandra is on the line. What questions do you have for Dr. Gullatt?
Hi.
Hey, how are you?
Good. I would like to ask you a question about women that went through menopause. Some women have hysterectomy.
Have you already had a hysterectomy? Or I'm sorry, go ahead.
A lady I know had a hysterectomy, and she had been, pre-menopause. She went straight to menopause, and she's not able to understand why she have all these different symptoms.
Well, that sounds like a patient who needs to see an OBGYN physician. It's hard to know what her symptoms are. If she had a hysterectomy and had her ovaries removed, then a lot of times you will have menopausal symptoms, and it depends on her age and things like that. Sometimes those symptoms are safe to treat with hormones. Other times we find alternative ways to make them comfortable and treat their symptoms. So it would depend on what her symptoms are, how old she is, and whether or not her ovaries were removed during her hysterectomy.
Okay.
Do you have any
I
more
have
questions?
another question.
Oh,
Yes. Does those women have like mood swings?
After having a hysterectomy?
Yes.
It is common
Yes.
after having a hysterectomy, you know, when your ovaries are removed, if it kind of puts you through surgical menopause, and you can have menopausal symptoms where mood swings and hot flashes and night sweats are common symptoms that come along with menopause.
Okay.
all right. So you still get all of the side effects of being a woman without having all of the parts in there. Your body still knows what it needs to do, or it still goes through the changes.
Yeah, if it happens, yeah, right. Basically what happens when you go through menopause is your ovaries, when you go through menopause naturally, is your ovaries slowly quit producing estrogen. And it's the lack of estrogen that causes the symptoms that come along with menopause. Now, some women go through menopause and they have no symptoms. Their only symptom is they stop having a menstrual cycle. And once they go a full year without having a menstrual cycle, then they've considered to be in menopause.
I need to know what those women were doing.
I know.
Prior
And
to.
I have patients that, are so, confused, and I'm like, consider yourself lucky, because but it really is just, patient dependent. Sometimes maybe it's somewhat genetic,
Do you
but
think it's the way they eat? I mean, is there something
I think
that
a
I
healthy
can do?
lifestyle and exercise and all that is very important, and it definitely helps makes going through menopause easier on you. But the alternative, so that would be kind of natural menopause, and where you have hot flashes, night sweats, your menstrual cycles, eventually stop. And then what she was asking about is a hysterectomy. So I think some people get confused. When you have a hysterectomy, we do not always remove the ovaries.
Okay, and it looks like we have another caller on the line. Her name is Sarah. Sarah, what questions do you have for the doctor today?
Hi, I've never had a hysterectomy, but they said my ovaries, they can't find one or something like that. Like it's lost or something. Is that normal?
I'm sorry, I didn't understand what you said. What happened to your ovaries?
She said one of her ovaries might be lost.
So you had an ultrasound done and they did not see one of your ovaries?
Yes, ma'am.
Okay. So, and you've gone through menopause?
No.
You have not?
No.
Okay. Sometimes, depending on the day or the ultrasound, we aren't always able to visualize ovaries on ultrasound. That doesn't mean that it's not there. Sometimes, I guess there can be some anomalies where patients are born with only one ovary, but a lot of times it's just related to the day, and there can be some things that can make visualization of the ovary difficult because they can be really small and hard to visualize on ultrasound, but that doesn't necessarily mean that it's not there.
Oh, okay.
So-
Okay.
If she were to get another ultrasound done, they could find it. I mean,
There's a chance that yes, if
It's hidden, or-
right, exactly.
okay.
If she had it done, on another day or a couple weeks later or something, they may be able to see something different.
but it didn't just go away.
No, odds are it did not just right.
Okay.
Either she never had one to begin with, or it just wasn't visualized on ultrasound.
Okay. Sarah, does that answer all your questions?
Yes, ma'am. Thank
All
you
right.
very much.
You're
Thank
welcome.
you. That is so interesting to know because, yeah, it's not like, Betty Dawn is on the line for us. Boy, you're getting all the calls today. Good afternoon to you, Betty Dawn.
Hi, how are y'all doing today?
We are doing just lovely.
I'm doing good.
I had a question for the doctor. I have one ovary, and do it cause me to have the night sweats and stuff from that? I was just listening at lady called earlier. I was listening at you, and so I don't have two ovary, but I have one. I have a partial hysterectomy. I don't have a whole hysterectomy, but I have a partial.
So by partial hysterectomy, you've had one ovary removed and your uterus, correct?
Yes.
Okay. And how old are you?
Yes. Yes.
Okay. How old are you?
I am 65.
Okay. So the average age of menopause.
65.
Okay. You said 55?
65.
65. Okay. So the average age of menopause.
65. 65.
Okay. I forget my age sometimes too. The average age of menopause is 51. So most women by that time have gone through menopause or are going through, depending on several factors. So odds are, even though you have one ovary, you've already gone through menopause, and that one ovary is not functioning or not making estrogen anymore. So you should not. You usually have hot flashes and symptoms of menopause when you're going through menopause. After that, your body kind of adjusts to not having the hormones, and later in life, like at your age, you should not have hot flashes come back.
Oh, I still have them sometime, I think, in the night sweat, because I've had the C19, and I had that going, and I broke out in a sweat, and I had to change my night shirt twice.
Mm-hmm.
That's how I knew I had C19 when I went to the ER Friday morning, the day after Thanksgiving.
Yeah, and sometimes, night sweats and hot flashes aren't always related to menopause. So I encourage patients that are, have gone through menopause already and are in their later, 60s into 70s and having hot flashes or night sweats. I encourage them to see their primary care doctor, because sometimes those symptoms can be signs of other things, or even medication side effects or things like that. So we dig a little deeper when that's going on.
So Sarah, I'd recommend.
Okay, thank you so much. You've answered my question that I need to know.
Excellent. Thank you, Sarah, for calling in today. And once again, for folks who do need to go see an OBGYN, why don't you let them know how they can get in touch with you? We know that you're at Willis-Knighton.
Yes, I'm at Willis-Knightton Pierremont with the OB-GYN Specialists group. Our office is on the 6th floor of the, in the hospital building, but they can call us at 212-3890 to schedule an appointment with myself or my partners.
All right, sounds good. And it sounds like you got quite a few partners up there, but we've got one more call to answer today, and I believe Julie is on the line for you. Good afternoon to you, Julie.
Yes, I'm calling because I'd like a question. First, I'd like your number that you gave and your location.
Willis-Knighton Pierremont, OBGYN Specialist.
Okay.
I hope I'm saying the right number. Maybe somebody can cross-check me. But 212-3890.
Okay.
And my name is Dr. Gullatt. And my partners are Dr. McCalmont, Dr. Huddleston, and Dr. Paul. And we have 2 more coming in this summer.
And my question was, what do you suggest? I think a person have a vaginal prolapse, and they're like 74 years old.
There are a lot of things that we can do to treat that and relieve your symptoms without doing surgery. But there are some surgical options. So I would recommend starting with a OBGYN physician, and then either we'll be able to help you or we will get you in with a urogynecologist if we're not able to help.
Okay, well, I was actually trying to find a new gynecologist.
Well,
We're
it
happy
sounds like
to
you've
take
got
care of
her
you.
right here. Well, thank you so much for calling in today, Julie. We have to wrap this up. We are at the very end of our newscast, but please reach out to her. We would love that. And you've got all her information right there. If you want to just shout it out real quick, we've got 15 seconds left.
My name is Erin Gullatt. I'm at Willis-Knighton Pierremont OB-GYN Specialist, and our number is 212-3890.
Have a blessed day, everybody, and thanks you so much for calling in today. Thank you, Erin.
You're welcome. Thank you.